Welcome to our next candidate forum tonight on Channel 17's Town Meeting Television. We're very lucky tonight to have representatives from South Burlington. I'd like to introduce Pugh and Maida Townsend. They are running unopposed in their districts, and they're here to just remind everyone why they are running. And we'll get into a nice discussion about some of the issues that are affecting South Burlington, especially from a state level. There is a number you can call anyone out there that's watching right now. It's the 862-3966, and we'd love to get a question from someone. But I'll start off, let me start with Ann. Why don't you remind your constituents why you're running and the things that you are important to you.
Thank you. And I want to start first to say thank you to Channel 17 for hosting this. This is the 14th time that I have come before this camera, and I think this is a very incredibly important function that Channel 17 does in terms of bringing candidates to the public and asking us these questions. So thank you. And I want to thank the voters of South Burlington who have given me the best job I could ever ask for. It is a huge honor and privilege to represent you. And I've been representing you since 1993. This is the first time that I am running without an opponent, and I appreciate that. It doesn't mean that I'm not coming to your home, and thank you for welcoming me into your home and sharing your joys, your ideas, and your concerns about how to make South Burlington and how to make Vermont more welcoming and to be the state that we all know and love. And I'm running, as I have always run, to make to build on Vermont's strengths. Vermont has a lot to offer. We are a wonderful state. We have an incredible workforce. We have an incredible waterways and natural environment, and we are, for the most part, a welcoming community. And I'm running to make sure that every Vermonter has a solid chance and to become the person that they want and to live and play in Vermont.
Thank you. Maida, this is your chance.
Yes. Well, thank you very much. I am running for my fourth term to the House, representing the generally known as the airport district of South Burlington. I feel very intensely my relationship with and my responsibility to my constituents, and I believe I still have a great deal of energy to provide to them in terms of my experience now over the last 6 years, the last 2 of which I was chair of my committee, Government Operations, in the House. My work ethic, which my folks know is pretty much nonstop, and my fairly highly intense level of constituent outreach and service. I would deeply want to continue that on behalf of my people, my constituents. The other reason that I'm running is that in service in House Government Operations, the committee on which I've served all 6 years and hope to serve these next 2 years again, I'm all about transparency and accountability in government. And I know a ton more about all of that, with all of the ins and outs and the different layers and all of that, having given the 6 years so far immersed in matters related to transparency and accountability in state government. And I believe I have something to offer.
Let's start there a little bit, Maida. If I can get you to expand a little bit, and Ann, I want you to answer this as well, too. Let's talk about that government effectiveness and transparency. Now that you both have been in the system for a while, what do you see are the things that we can do to make things more effective or more transparent? How do you see that as...
Can I ask you a question? What is ineffective? What is not working from the question assumes that there is a problem. So what is the problem?
I would say that's generally people feel like, there's a general kind of and it may be wrong, but that things are not as efficient, monetarily or financially,
Okay,
or
that's what you're talking about.
communication and those types of things, that they feel like they're not as quite connected to their state government, and it may be that they're not connected. It may be their own fault, but that's one of the reasons why I think that getting that out on the table is a good thing.
So, since you've clarified, and I happen to be the co-chair of the Government Accountability Committee, which is separate from the House Government Operations Committee, personally, when I want to check in on, let's make darn sure as to how well we're doing or not, I look at the data. First of all, I go online, and for all of the departments and agencies in state government, you can find for most of them, if not all at this point, their so-called report card right there on their website. And it's framed in terms of results-based accountability, answering 3 questions. What are we doing? How well are we doing it? And has it made any difference in anybody's life? And the departments and agencies are responsible for posting and keeping up to date that report card. The other place I look for data is on the state's website that's entitled spotlight.vermont.gov, spotlight.vermont.gov. And there you can find the annual performance reports, which are focused on the 10 state outcomes that are written into statute that we are supposed to be targeting everything toward. For instance, the very first of the state outcomes is Vermont has a prosperous economy. Second one is Vermonters are healthy. They're big issues that are pretty much, motherhood and apple pie kinds of things. And there are indicators for each of these outcomes. For instance, just a couple for the outcome that Vermont has a prosperous economy. There is the number of children and adults living in homelessness. There is the percentage of children living at or above 200% of the federal poverty level, things like this. And there is a narrative, and there are a series of charts showing over time, over the years, whether we're going like this or whether we're going. It's all right there. Now, being involved with the Government Accountability Committee, the mantra of which is you cannot improve something if you cannot measure it, and you cannot measure it if you don't have data. So we push for the data in House government operations. It has become perhaps annoying to witnesses. Sooner or later, we're always asking, so what's the data that backs up what you want us to do for you? Why, data. The other data that I personally look to get a sense of how we are doing in terms of state government, I talk to my people. I talk to my constituents, because as you have inferred, sometimes perception can be, not sometimes, most often, perception becomes reality, at least as one goes through one's daily toil. So I talk to my folks and I get a sense of where they're coming from, and that gives me the opportunity that if there is mistaken information, gives me the opportunity to say, but it's this, here's the real story.
Yeah, and so what's your experience? And part of this is how do we answer the person out there that says, "Oh, I think government is too big," or I just don't feel like it's serving me. That whether.
You ask lots of questions, and I feel like
I'm here.
And I feel like I should preface this by saying, A, I'm a social worker, and B, I'm a college professor at this point in time, and so I listen. And I ask questions. I try to find it. What do you mean it's too big? Tell me. Okay, what part is too big? What do you think we shouldn't be doing? And who should be doing it? And because blanket statements like that are hard to respond to.
Sure.
And on some level, I asked you the question, what do you mean by government not being effective? And some of that is, it's not effective because you're not addressing my problems, or you're not addressing my priorities, or the way, I think all Vermonters want Vermont to be prosperous, want Vermont to be welcoming, want our waters to be clean, want our economy to be strong, want everyone to succeed. We have different ideas on how to get there. And so, and sometimes you say, well, it takes too long. It takes way too long. Why don't you just do it? Well, my idea and your idea about how to make the economy stronger may have a similar thread, but may be all different. And a way, from my perspective, that continues to make our government work is, 1, forums like this, 2, a real free press, and 3, government outreach, for which Maida is the poster child. She goes around to her district at least door to door, at least 3 times a year. Election year, off election years, she goes out there. But in terms of she calls it our people. But in terms of Vermonters participating, voting, sharing what's not working, that is how we can be more effective. We're not going to be effective if we only hear one voice.
Yep. And you're both so passionate about it. I feel great about that. Let's talk about a specific issue like the opioid crisis that's going on. And specifically, we know in our county that it's an issue and it's affecting people and right across the economic strata and all different types of families. From a state level, how can you work with the state to help the statewide problem as well as the things that are happening in South Burlington? I'll let you start, Ann, if you want.
And if I could, it's most appropriate for Ann to start because she's the chair of Human Services. This is her bailiwick.
Thank you. And I am a NCSL's National Council on State Legislators. I am an opioid fellow,
Great.
and I have had the
asked the right questions.
and I have had the distinct privilege of speaking at a national conference because Vermont is actually a leader in addressing this issue, and so I got to not speak about me, but speak about what Vermont is doing. I want to go back to Governor Shumlin, who in his State of the State address said this is a he focused only on that, and he said this is a public health problem. And that began to change the conversation. And that was very important. We have, what the state does is the state, on some level, provides resources, i.e. money and people, and they've set up a structure and are what is in the vernacular known as hub and spoke, which is, while there is disagreement, the most evidence-based treatment for opiate addiction is medication-assisted treatment, also known as MAT. Mm-hmm. And Vermont's model of delivering it, which is having a clinic, a methadone clinic, which is more than just giving the medication, but also the therapy and the case management and the social supports for housing or job training or whatever, and having them now dispersed across the state. So I can say in Chittenden County, I just heard from the Howard Center that there is not a waiting list to get into the hub. And then and then there are an increasing number of physicians who are able to prescribe buprenorphine, which is another of the medications, in their office. And they have social workers and case aides and nurses to assist with the other aspects. That's a national model. And the fact that we have that across the state, and there are pockets, there are areas where we need it more, and Bennington is getting some soon and things like that. So on that level, the hospital, UVM MC, is momentarily going to be able to provide, when someone comes in, if they have overdosed in the emergency room, to be able to provide them with not only the Narcan, the reversal, but also when they leave, to provide them with buprenorphine in their hand, as well as an appointment. So those kinds of things are really important. What state legislation did was we set the stage for limits on prescribing. Because at one point in time, and this has, there's lots of reasons, the federal government and others, but if there was pain, we prescribed opiates, and we prescribed lots of opiates and more than what was perhaps needed. And so what state law does is state law, what we have done in Vermont, is we set the parameters for the Department of Health to work with physicians and the medical society to adopt appropriate guidance around prescribing. We can work with insurance companies to say, hey, why don't you start reimbursing for non-pharmacological responses to pain? We've done studies to show that, things like acupuncture does work. So talking about being effective, Medicaid did something. They did, and yes, there is. It can work. Those are all things. We're closing the barn door after the horse has left.
Right.
And what we now need to do is, one, continue to sort of look at what's working, and then how is the implementation going out? But okay, what does the barn need? Why is this continuing to happen? And what we are learning is that it has to do a lot with feeling of hopelessness and helplessness and a lack of connection to people around them, or a lack of connection in the community. And so some of what we can do is start to do that kind of work so that there is not as much of a take-up. And for instance,
I want to give Maida a chance.
yeah, sorry. Okay, so I'll stop right there. I'm sorry.
Well, no, but Anne is the expert
Okay.
on this topic. I would only add in that another way in which the state has been helping to address these issues is that we provide a modicum of financial support to entities such as the Turning Point. We have one here in Turning Point of Chittenden County, and I believe there are 16 of them dotting the state, and the state does give some support, not as much as we would like, but it's what we can do.
So just not to keep going on it too long, but so from a regulation standpoint, is the state working on implementing rules and regulations to limit?
We already have.
We've already done those things.
We have
so
limits.
You mean with regard to the prescriptions?
Yeah, prescription
that's
or
done.
treatment or any of those things. So you're feeling good about where they're going with that direction, and so.
Yes, feeling good.
Yeah, no, I don't.
And to circle back to your question about effectiveness, just because something's working now doesn't mean it will work in 2 years. So part of our job as legislators is to ask questions, and part of the community's job and the provider's job is to provide us with information and let us know when, this is no longer working. We need to do something different. And I'll just...
And part of that goes back to Maida's whole idea about achieving those, those goals and the directions. Maybe the goals have to be changed at this point to grab data that can be...
Exactly. And being willing to try new things.
Right.
Being willing to look outside of our borders to other states or other, entities, other countries. What are they doing?
Yep.
What are they doing that's working? Are we at a place where we can try those things or not? You ask about the opiate crisis, and on some level, what is as much of a crisis as, if not more, is fentanyl.
Right.
And that's a whole. And at one point in time, it was like, okay, let's get strips out to everyone so they can test. Let's give so that they can test if there's fentanyl.
Right.
Someone said to me a bit sarcastically, but not really, is we don't need to give out strips because 90% of the heroin now is laced with fentanyl.
Wow.
So what we need to be doing is not spending money on providing strips, but rather doing education on, like, if you're going to be doing this, be prepared. And then how do you not?
I think we could go on a long time with this.
sorry.
Yeah, go ahead.
Another piece which we don't want to leave out here is kind of old-fashioned. The importance at the family level, the community level, for people to talk to one another,
Yes.
to reach out to one another, to never close off a conversation, to not be afraid of opening a conversation. And certainly in the schools, there's a lot of work done with the youngsters in school at lots of ages, not just the high school. So that piece cannot be forgotten, going right back to parents really not being afraid to talk about these kinds of things with their kids.
Yeah,
and
exactly.
Also, to not leave medications in the medicine cabinet where people can think, oh, if grandma can take it, it must be okay for me to take it, because that has been part of this bigger picture. And something as simple as taking medications once one is done with it, any extra, going to one's local police department, there's a box. You just put it in there, it's
And
destroyed.
also in libraries.
And in libraries now too. Okay.
That's great. Well, let's talk a little bit, because I think this topic, by the way, I think is worthy of its own forum at some point. That I think that gathering people like yourself to come out and communicate on what's going on, I think that's very important. Maida, I want to ask, because we're getting close to where our time is going to run out, and I want to make sure we get. What are the big issues, or the issues that you want to really focus on in this next legislative session and beyond, that you think you're going to put your energies to at this point?
Well, it goes back to what I said at the beginning, the transparency and accountability piece as it relates to state government. I already know that we're going to be looking at campaign finance, the whole question of corporate money in politics. Do we want to move to an honest-to-goodness, full-blown public financing of campaigns? Is that the only way? Because there is a school of thought, and we're doing some research with some other states that think they've passed legislation to successfully remove corporate money from the process, but then it just goes into a dark money thing, and that doesn't cure a thing. So maybe a real public financing system is the route to go. But this is going to take a lot of study, a lot of discussion with witnesses and all of that. But that's one piece. Another piece which was brought to our attention at the very end of the last session was the matter of oversight for our sheriffs. There's mystery surrounding some of how, mystery as to how some things are done and who's accountable to whom and all of that. Okay, we're not trying to cause anyone to have heartburn, but it's part of our responsibility. Public safety, all of the law enforcement issues are part of our responsibility, and if we don't do the broad look, then we're not doing what we should. There's also the matter of the sheriffs, because the list gets longer once we're in session, but there will be a miscellaneous elections bill, because all of the elections law is within our purview also, some tweaking of things that could perhaps stand to make things a little more efficient, straightforward. There's also the matter of we need to look back at the beginning of the session at our vital records bill. We discovered...
Tell us a little bit about what was that.
Vital records looks at the birth and death records, and the major focus of the work we did during this last biennium was to close the door such that people from a mountaintop somewhere could not get their hands on our birth and death records, which they could. It was totally open door, which we thought was outrageous. So we did a lot of work on that, and part of closing the door was establishing the statewide registration system, computerizing, and setting the rules as to who are the only people who can have access, et cetera, et cetera. Okay, so the system was supposed to be up and running for the beginning of July this year. Mm-hmm. And we got the word, might have even been during the special session, that it wasn't ready, which created a very unhappy situation, shall we say. And one of the first things, I have put people on notice, I did that early in the summer, put people on notice that when we go back in January, they're going to be invited in, and they're going to have to explain themselves. What went wrong, and how is it being fixed? Because we extended the date for the statewide registration system to this coming July, but maybe it can be ready sooner than that, so that piece can be fixed. So we have to revisit that. There are also questions that need to be revisited with regard to the ethics bill that we passed last session. One of the pieces of that statute is that people running for office are expected to disclose certain pieces of financial information. Well, this person was not terribly happy when she heard that some persons wanting to run for office didn't think it applied to them. Because, and why not just continue to think it doesn't apply to a person if there are no consequences? Because built into the law, brand new concepts and all, we had not put any consequences. So we need to have, there are some of us who believe at least we need to have a conversation about consequences. I will confess that my knee-jerk reaction is, well, if you can't go along with the law as stated that candidates need to provide X, Y, and Z financial disclosure, if you're not willing to do that, well, then your name is not on the ballot. I have no idea if that's constitutional or not. We'll find out. Or, barring that, can there be a little fine? I don't know if that's constitutional. But you see, the fact that some people, the vast majority followed the law, and our thinking was not to put consequences in because people would be law-abiding, but that some people thumb their noses at the law. That we cannot just turn a blind eye on that.
Right.
So,
and do you have things you want to focus on this coming session?
I have been chair of the House Human Services Committee, and I want to say
that's big.
It's big. I want to say it. So what I believe that we will continue to focus on is how to invest in people, how to shore up people, how to remove any barriers so that every single Vermonter, whether they're over 65, whether they're a person with disability, whether they're a child, whether they're a person living or family living in poverty, that whatever barriers that we are able to address or remove so that they can succeed, because I believe that improving our economy means investing in people.
So let's just follow through with that. So from an economic standpoint, to help the economy in the state to make it more prosperous, because there's all these predictions that
if people are living in poverty, they won't buy things.
Right.
If people aren't able to get out of their house because of barriers, we won't buy things. And there are jobs that are not being left unfilled because people don't have the training.
We have a phone. Did we have a phone call? Did we? No, never mind.
There are jobs that are unfilled because, and we have people who want to do them. We have young people who want to come here, or young people who want to stay, in young families who are not going to be able, or say a barrier to them staying is not having access to childcare, or not having access to paid family leave. If we are going to support the economy, we need to support families, because workers are members of families. And when I'm at my job, I do my job. But when my family is in disarray, I'm not going to be doing my job as well as I could. And if I need to leave my job for a bit of time to take care of my sister, my mother, my father, my new child, my new baby, how can I do it in a way that I can then return to the workforce?
We have, as you probably can guess, just a few more seconds left. Maida, do you want to finish off by just, with anything you'd like to make sure you didn't get a chance to say, or?
Well, it does not pertain directly to my committee.
Sure.
I would want to call everyone's attention to two reports that came out this week. Well, one was one of the Nobel awards in economy. And the key message from the gentleman at Yale, whose work was honored, linked climate and economy.
Interesting.
And if economic development, he said, if economic development is thriving, that's liable to be hurting the climate because of all the fossil fuels and all of that being used up as, economics are pursued. However, he also said, if the climate is not cared for, if climate change is not addressed, then that's bad for economic development. There's also the fact that there was the report from the UN this week, the Intergovernmental Committee on Climate Change.
Yep.
They pointed out we've got to do something around the world fast, because the goal is to cap the greenhouse gas warming at 1.5 degrees Celsius. We have already gotten 1 degree Celsius warm. That 1/2 of a degree is left to get to that cap.
And circling back to government effectiveness across the world, someone did the top 100 things you can do. One is educating women, and the other is family planning, and those are in the top 10 to deal with climate change.
I want to thank you both. Not only do I feel confident about South Burlington and their representatives, but I feel better. You've educated me quite a bit here tonight as well, and we have to wrap it up. Unfortunately, I wish we could keep going, but folks, thank you for tuning in tonight, and you can find us on the internet, and we'll see you again at Channel 17 Town Meeting Television. Thank you, ladies.
Thank you.
Appreciate it.